donation is critical because the essence of giving blood is giving a vital unit of oneself. There are needs for blood donation, and the needs are all clinical. The needs are medical. If a patient needs blood and is giving 1,000 units of infusions, that patient will not recover. There's a need for a sure, steady supply of blood, and that is why our donors need to walk into our doors every day to give. Why do we come back ever so often requesting for blood? Because the blood you give to us has a very short shelf life, 35 days. So we constantly need donors to be giving. Blood donation is not a one-off thing. It is a regular, constant stream of a steady supply that will ensure that our blood banks are fully stocked to meet needs. What are the needs? The needs are clinical. Some are acute, that means they are emergencies, and some are chronic, those that are not emergencies. The needs for blood can be for resuscitation of trauma. When people have road traffic accidents, they need blood. When they break bones, they need blood. When they vomit and cough up lots of blood, then it needs to be replenished to save their lives. So blood needs to be replenished when it's lost, and when it is broken down, it needs to be replenished. How does it get broken down? There are some diseases, chronic diseases, that leads to red cells being broken down. There are certain medications that when people are given, their red cells are easily broken down. So for diseases like sickle cell disease, thalassemia, chronic conditions like patients on chemotherapy, they ever so often require blood. And all these reasons make blood donation very important and critical. It is safe to give blood in Ghana. The Blood Service is the agency under the Ministry of Health mandated to ensure that there's a safe collection and availability of blood for patients. We follow protocols. We have laid down protocols to ensure that every step of the way, the donor's health, importantly, is not compromised, and the recipient's health is also not compromised. So we follow laid down protocols. Most of our consumables are single use. The needles we use are single use. Everything we need and use around a collection of blood is a single use equipment. So it is safe, it is sterile, and it is not going to put the donor who donates at risk. For that reason, I would want to reassure anyone who wants to consider it. The standard interval for blood donation is 4 months. In Ghana, we encourage that someone can give blood every 4 months. And as part of giving blood every 4 months, we ensure that your ages are between the ages of 17 and 60. On the day of donation, you should be in good health. You should have had a meal before donating to ensure that you do not feel faint after the donation. And we also ensure that after you have donated, you should have a refreshment. You should be given something to drink immediately after the donation to ensure that the volume you have lost is immediately replaced. Misconceptions about blood donation are varied. A few that have been in the media, which I would like to touch on, are the fact that people sometimes think that the donated blood is used for rituals. Unbelievable. We are able to track every unit from the minute it is donated, from the donor's arm to when it is received by a patient. So there's no harm, there's no need for anyone to consider that a unit of blood given to the blood service or given to any of our hospitals is used for rituals. There are conceptions that if you give blood, misconceptions that if you give blood, one can become impotent. That is a very, very ridiculous one, if I may say. I mean, we have vibrant donors who are males, who have families. Some started giving as students in their second cycle schools. They gave and have given till they are 60 years. They have given and they have families. They have children. So there's no problem. There's no link to blood donation and impotence at all. There are some that say that if you give blood, you'll be giving off your behavior. If somebody is a talkative, or if somebody is a liar, or I mean, you give off your human traits in giving blood or in receiving blood, and none of these are true. I mean, if you give blood, you should expect that you will have a small pinch of pain. So if that is the fear people envisage, you should just see yourself closing your eye and enduring a mosquito bite. That is the magnitude of the fear of pain you should expect. So roughly, the misconceptions are mainly spiritual, thinking that the units are also going to be used for voodooism and things like that. But I don't think that the public have any cause, there should be any cause for alarm, because we are very accountable as a blood service and we would not engage in any such activity. And our doors are also open for audits of units that have been given at any of such collections if there is a need. Any donor who feels unwell on the day of donation can be temporarily deferred. The donor's health is critical to us because the donor must feel well to be able to give a unit of blood uneventfully, so that at the end of giving that unit of blood, which is actually 450 mils of blood leaving that donor must not feel compromised in any way. The blood that donor is giving should also be of use to the recipients. So if a donor is unwell, has malaria, or has a bacterial infection, obviously these infections will be carried in the blood, and therefore we need to ensure that the donor has fully recovered before he or she comes to donate, so that we do not jeopardize his or her health, neither do we jeopardize the health of the recipient. As part of the protocols of giving blood at any center, donors are given an opportunity to go through a questionnaire, and at the end of the questionnaire, they are given an opportunity to say whether they want to give blood that day, and as a result of that, whether they are healthy enough to give blood. They are also given an opportunity at the end to self-defer. One self-defers when he has read the questions and finds on the day of donation that he doesn't qualify. He's either unwell or is harboring some illness, or by giving blood, he may compromise the recipient. So that is a critical step of the donation process. As part of the World Health Organization's support and dictates for blood donation, it is urged that every country has 1% of its population giving blood. So with a population of 33 million of Ghana, we would expect that we would have 330,000 voluntary donors regularly giving blood to us. At our last count, we had collected over approximately 190,000 units of blood. So though our blood collection index is about 6.2 per 1,000 units, it is expected that with the help of you donors out there, with the help of you listening to me as we celebrate World Blood Donor Day, you join hands with us to continue collecting. If you haven't given before, reach out, stretch out your arm to give a unit of blood so that we can increase our blood collection index from 6.1 to 10 per 1,000 as stipulated by the World Health Organization.
My name is Samuel Esiedu, and I'm the director at AngloGold Ashanti Malaria Control. Did you know that every blood that you donate can save up to 3 lives? Save blood saves mothers, children, accident victims, and patients with chronic illnesses. Every drop counts. Give the gift of a life. Thank you.
My name is Emmanuel Fiagbe, Executive Director for Communication Initiatives for Change, and also co-chair of the Interagency Committee on Health Promotion for the Ghana Health Services. On this important day, 14 June, which is recognized as World Blood Donor Day, we want to call on all Ghanaians to wake up to the challenge of donating blood so that others can be saved. And for those who have been donating regularly, we want to recognize them and thank them for their efforts in supporting the saving of lives of others. And for those who have not been donating, particularly Ghanaians, able-bodied and healthy between the ages of 17 and 60, we want to implore you to get on board and become blood donors. When this is done, Ghana will have enough blood in all health facilities that can be used in saving the lives of our mothers, of our children, and even those who are involved in accidents. This is our message for you on this important day. Thank you.
As I end this discussion, I'll urge our donors out there, and in fact all Ghanaians from Gambaga to Accra, to consider blood donation not as an act of charity, but as an act of patriotism and love, an act that binds us all as one community and brings us together as a stronger Ghana. Thank you.
Someone out there needs blood, but the shelf line is just 35 days. That means hospitals need it every single day. Donating takes just 12 to 15 minutes. A small moment for you, a lifetime for someone else. Join Sonotech Medical Center in partnership with the National Blood Service for the 4th edition of our annual blood donation exercise. Saturday, the 14th of June 2025 at the West Hill Small Car Park from 9 a.m. to 4 p.m. Come share love, save a life, be a hero. For questions, call us on 0308 040 036. Share love, save lives, be a hero. See you at the West Hill Small.